Hi guys, I'm Brianna,
And I'm Jesslyn.
and today we're going to take you along in a day in the life as an occupational therapist who is implementing some Pilates interventions.
So Pilates was developed by Joseph Pilates in the 1900s, and it's been increasingly popular lately.
It's an exercise method that increases strength and endurance of the core muscles and also helps improve flexibility, dynamic postural control, and balance.
So it utilizes breathwork techniques in various positions with increased repetitions of positions.
It uses core principles of traditional Pilates with modifications based on the patient's needs and ability levels.
So Pilates has become the most popular exercise method in recent years all over the world, and it's stated that Pilates training can be used in both rehabilitation activities by adjusting the intensity, type, and duration.
As the positive effects of Pilates have been seen in both healthy and elderly populations, it is starting to be more widely used in neurological illnesses where balance disorders are seen the most.
So Joseph Pilates believed that beginning exercises in the horizontal plane was important to relieve stress and strain on the joints and to align the body before adding additional gravitational forces through the central axis while standing, sitting, or kneeling.
Pilates complements OT core principles because it emphasizes core strength, posture correction, and controlled movements that improve flexibility and balance needed for the participation in ADLs. And before we begin our treatment session, let's talk a little bit about some precautions and contraindications.
So some precautions are: you must have a safe exercise environment. You must consult with your healthcare provider before participating. You need to stay hydrated. You need to have a certified therapist or instructor present at the time of exercise to coach you through it. And orthostatic hypotension or hypertension is another precaution to be mindful of avoiding quick position changes.
And some contraindications while performing the exercise may be excessive pain, some spinal, sternal, or hip precautions, or severe cognitive decline may impact performance.
So my first patient has MS, which is an autoimmune disease that affects the central nervous system and causes problems with vision, coordination, balance, loss of strength, numbness, and fatigue. So now I'm going to treat my next patient with Parkinson's disease, which is a movement disorder of the nervous system. And for this exercise, it's going to be a seated position, and I'm going to have her pull her knee up towards her stomach, count to 5 and relax, and then do it with both feet 10 times. So I'm just writing some soap notes from today's sessions, and my patient with MS, her endurance and balance was improved as a result of increased core strength, and she also said that her confidence was developed in her mobility and balance related to her ADLs after participation, and she also stated that her severity of fatigue decreased. Now I'm going to do my soap note on my Parkinson's patient, and she demonstrated improved functional mobility, reaction time, and balance compared to previous sessions after participating in high repetition Pilates.
Okay, now I'm going to be treating my patient with fibromyalgia, which is a chronic condition that has caused her a lot of excessive pain. My next patient has suffered a stroke, which has impacted her core stability and strength. So we're going to do some Pilates exercises to work on that. I'm going to finish up my SOAP note after treating my patient with fibromyalgia. Patient reported experiencing less pain from a 5 to a 2 on the pain numerical scale. Overall, treatment was successful. Now I'm going to finish up my SOAP note after treating my stroke patient. Patient demonstrated increased balance, postural control, muscle strength, and walking ability after engaging in high repetition Pilates. Although through our research we have identified that a certification is not required to implement Pilates into rehabilitation, it is highly encouraged to seek a certification before implementing any Pilates interventions into rehabilitation.
So overall, Pilates is cost-effective intervention. It builds core strength, promotes posture and balance, coordination and alignment needed in order to carry out activities of daily life.
Pilates and neurological rehabilitation promotes wellness, recovery, stress management through exercise, and overall well-being. It is a key focus of occupational therapy practice.
And that's why it should be implemented.
Thank you.